Hi, welcome to week 7 GI system video on irritable bowel syndrome for NU 621 advanced pathophysiology. This video will provide several questions such as you might have in a quiz, multiple choice answers with explanations for the correct answer. I will give you time after I read the question and present the answers to think about it and retrieve memory from your readings to answer the questions. Let's get started. Question number 1. Which of the following infections has been associated with an increased prevalence of irritable bowel syndrome? Number 1, Giardia lamblia. Number 2, Escherichia coli or E. coli. Number 3, Shigella, or number 4, Salmonella. Let me give you a few seconds. Okay, the correct answer is number 1, Giardia lamblia. Research has shown that Giardia leads to an increased prevalence of irritable bowel syndrome and chronic fatigue syndrome. What seems to be the explanation for this is that even after exposure and treatment for Giardia, the patient may be experiencing irritable bowel syndrome symptoms as long as 3 years after the exposure to and treatment for the Giardia. So this has terrific implications for patient care. Next question. Which of the following is a symptom consistent with a diagnosis of irritable bowel syndrome? Number 1, painless diarrhea. Number 2, fever. Number 3, postprandial urgency. Or number 4, steatorrhea. I'll give you a few seconds. Okay. Did you get number 3, postprandial urgency, or the need to defecate after ingesting food or a meal? It's common in irritable bowel syndrome. It's associated with the chronicity of irritable bowel syndrome. If a person reports having postprandial urgency, it can help guide you to the correct diagnosis because it is not an acute symptom. Also, alterations in constipation and diarrhea are associated with postprandial urgency. One time they may have diarrhea, the next time they have postprandial urgency, they may have constipation and the urge to go, but the inability to do so. Question number 3. Which of the following is not recognized as a symptom that supports the diagnosis of irritable bowel syndrome according to the Rome criteria? You may not have run into the Rome criteria in your readings. I will review those after we answer the question. So which of the following is not recognized as a symptom that supports the diagnosis of irritable bowel syndrome according to the Rome criteria? Number 1, altered stool frequency. Number 2, mucorrhea. Number 3, abdominal bloating or subjective distension. Or number 4, frequent nausea. Just take a few seconds. Ready? The answer is number 4, frequent nausea. The Rome 3 criteria, which has been recently updated. The Rome criteria for the diagnosis of IBS includes recurrent abdominal pain or discomfort at least 3 days per month during the previous 3 months. This abdominal pain and discomfort is associated with at least 2 of the following symptoms: relieved by defecation, The onset is associated with a change in stool frequency and a change in stool form or appearance. So all of these conditions need to be present in order for the Rome criteria to help you diagnose IBS. Other symptoms of irritable bowel syndrome are as follows: altered stool frequency, altered stool form, altered stool passage, and associated with straining and or urgency, mucorrhea or mucus, and abdominal bloating or subjective distension. The patient tells you they feel bloated and distended. Which of the following symptoms indicates a need for laboratory testing or diagnostic imaging in patients with irritable bowel syndrome younger than 50 years of age? Number 1, iron deficiency anemia. Number 2, abdominal pain. Number 3, amenorrhea. Or number 4, hypokalemia. Ready? Number 1, iron deficiency anemia. The American College of Gastroenterologists put out a position paper in 2009 on the management of irritable bowel syndrome. This position paper does not recommend laboratory testing or diagnostic imaging in patients younger than 50 with typical irritable bowel syndrome and no alarm features. The alarm features are defined as follows: weight loss, iron deficiency anemia, family history of certain GI illnesses such as inflammatory bowel disease, celiac sprue, or colorectal cancer. So, in other words, if a patient younger than 50 presents with the symptoms that we reviewed in the prior slides and doesn't have the alarm features that I just went over, then they don't need any other diagnostic imaging or laboratory testing. A good reference is the one I cite here by Lehrer and Lichtenstein. This is where I obtained it, and it really is a concise document for irritable bowel syndrome. Gives you an overview, gives you the demographics and the epidemiology, as well as the typical symptoms, the Rome criteria. It's very concise and very comprehensive. So if you have any questions, please refer to this reference. If you still have questions, please don't hesitate to contact me. Thank you.